I was ashamed of HIV. I didn't want to take medication. I really didn't want to live. I was having psychological issues, emotional issues. I had financial issues.
I was 17 years old. I was devastated. It was the feeling of walking into an emergency room and knowing that I had something everybody else was scared of.
It really shakes your total foundation because of all the stigmas and all this hearsay and daresay and all the superstitions that come along with it.
I think I had a small fear about stigma, but not to the point where it was going to stop me.
I mean, the stigma can destroy you or think rational and live.
Access to Care is about leveraging public and private resources to fund local communities to respond to the epidemic in their community. From San Francisco and Oakland, Los Angeles and San Diego, to New York and Boston, St. Louis to Chicago, Washington, D.C., North Carolina, Atlanta, Montgomery, Alabama, and Louisiana. Amazing programs focused on linking people and keeping people in HIV care. Because this is how we end AIDS in America.
For us, the issue was we needed to not wait for people to come to us, but we needed to go to them. With our private funding, people go into bodegas and parks and community centers and actually find people who've dropped out of care.
And if you allow people in this world to push you to the side and kind of put you in a closet, they will. And it's up to you to make sure that you're on the front lines. It's up to you to voice your opinion and make sure you get the care and the services that you need.
The mobile unit provides access to care for individuals that would have hardship traveling to urban areas.
And through this program, Region 9 Access of Care coming out of Duke University, it's given me as a person the ability to get out and reach other people as myself suffering from the same barriers that I'm suffering from and let them understand and know how I got over those barriers.
When a patient comes here, they're seen not only for their medical care, we also provide education and support, a nutritionist, as well as substance abuse and mental health counselors.
The 9 regions that we serve, without health and motion, not only would the people not be getting the medical services that they needed, but the spread of HIV would be continuous.
Prior to this program, individuals who may have been identified as being HIV positive would probably have not stayed in care, would not have made it to that first doctor's appointment. These access coordinators have made it possible for the individuals to make it to that first appointment and therefore stay in care.
Without access to care, Andre would just be slowly dying. He was not a person who took care of his mental condition like he was supposed to. He didn't take his meds like he was supposed to.
Now I'm medicated on both my mental health issues as well as my HIV issues. I'm volunteering Tuesdays and Thursdays, and Monday, Wednesdays, and Fridays I'm in class. I'm living a much more full and productive life.
Bringing people in for services is the first step, but making that service patient-centered and ready to serve that person well is another issue. And so our project has had a collaborative with 6 community health centers to actually achieve patient-centered medical homes.
In working with ImediCare, they help get us the patients. And it's our job, once the patient's routed to us, that we keep them engaged. This funding is providing CalNORD the opportunity to learn about patient retention efforts.
Access New York has helped us the most to develop a team-based approach to care. We're developing a team model where each provider works directly with a known nurse. We've been working really hard on decreasing our cycle time, which is now down to about 45 minutes. And that means that from the time a patient comes in the door to the time they check out, they've gotten to see their provider, gotten their labs drawn, and gotten their shots and vaccinations done in 45 minutes, which is kind of unprecedented, whether in the private or the public sphere.
It's togetherness. People coming together, you meet new people that's in the plan. It's the whole idea of togetherness.
We can end AIDS in America. We have the tools, we have the smarts, and access to care is one way to do it.
Make it grow.
Make it grow.
Make it grow.
Not only make it grow, but make it flourish.
Make it grow.
Make it grow.
Make it grow.
Make it grow.
Let's make it grow together.
Make it really, really grow.
We really needed to make it grow because we don't have control of this disease, and if you don't step in and help us, we might not get control of it. We can't depend on the government to sponsor everything. So if you sponsors out there and you're listening, make it grow.